Hello, everybody. Good afternoon, and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Virgili, Hispanic Public Information Officer for Montgomery County Government. And with us today is Acting Health Officer Dr. James Bridgers, as well as Assistant Chief Administrative Officer Dr. Earl Stoddard. Reporters, all of you should have that permission to record. If you do not, please use the chat. And now I toss it to you, Mr. County Executive. Good afternoon.
Good afternoon, and thank everybody for joining us today. I'm going to start on what we're seeing right now. We're beginning to see some good trends as the latest wave of cases we've experienced over the summer due to Delta have begun to plateau and subside a bit. Today, our positivity rate is 2.01, and we have a case rate of 10.85 per 100,000 residents. And both those numbers are the best in our state, and our case rate is almost half that of the state's overall average. So we're now hovering between substantial and low transmission. We haven't passed into low transmission yet, but we're on the cusp of that. And when the most recent COVID surge approached our county, we took the necessary precautions, such as indoor mask mandate, and the outcomes once again have proved that those decisions, along with our high vaccination rate, have resulted in Montgomery County being the safest large jurisdiction in this nation from the pandemic. And once we can return to low transmission rates in our community, we'll be able to lift the indoor mask mandate once again. However, we still had 95 positive cases yesterday. As you can see from the graph that you'll be looking at, this is not the lowest we've been. We actually were lower early in the summer. And so even at 95, that's 10 times the cases that we were experiencing, more than 10 times the cases that we were experiencing earlier. So that is significant, but it is better. Vaccines did not bring us the freedom or the mission accomplished that moment that I think people wanted to have. We haven't quite yet accomplished the mission, and the Delta variant is obviously much more contagious than the previous versions of this. And we know this is not the end of the variants. And so we're going to have to continue to be vigilant and listen to what the science is telling us about the other variants that are out there, and continue to be ready to act accordingly if it looks like we need to take more protective steps again. But the good thing that I take away from this is that our ability to do the things that we've done actually did result in better results than most places had. And Montgomery County is not that different than the rest of Maryland. There are plenty of counties that are not dissimilar to us, and there are certainly plenty of counties in this country that aren't dissimilar to us. But our results have been dissimilar, much more positive, much better, and I think it has everything to do with both what we asked everyone to do, but more importantly, for everybody's compliance and making sure we make ourselves as safe as we can. So this week, we've got 75.5% of our total population are fully vaccinated, and about 83.2% have had at least one dose, and 89% of the eligible population, and we always wind up talking about the eligible population, they represent the people who are 12 years and older. 89% of the eligible population is fully vaccinated, and 98% of our eligible population has at least one dose. 95.9% of our 65 and older population is fully vaccinated, and 99.9% have had at least one dose. These are pretty astounding numbers, and they really are due to the residents of this county listening to what we had to say. And I think you can look around you and see that it actually made a difference. And so I think the fact that it's different here reinforces for people the value of all the stuff that we've asked them to do. We're still continuing to see a slight increase in vaccinations. It's great news, as we are seeing that about a third of the cases and hospitalizations are from people who were previously vaccinated. These breakthroughs, though, are important to note. They can happen to anyone. Last week, I shared with the media my story about my son being a breakthrough case. He was sick for a few days, but then he felt better, and his vaccine likely stopped him from having to be hospitalized. So there are lots of stories about why this getting vaccinated makes sense. We are now authorizing, the boosters. The federal government's made the decision. Last week, the CDC recommended that certain populations receive a booster shot of Pfizer. I know that many of you are waiting for Moderna and Johnson & Johnson. They probably are a few weeks behind in the process. But the guidance on the Pfizer is that people who are 65 and older and residents in long-term care settings can get it. And people aged 50 to 64 with underlying medical conditions can get it, and people 18 to 49 who are at high risk for severe COVID due to certain underlying medical conditions, or who are at increased risk for COVID related to their likely exposure, most likely through their jobs, they are also eligible for this dose. And the dose is recommended to be given, I believe it's 6 months after your last dose. These boosters are critically important, and I encourage everyone to refer to the information available on the county website that explains how the process works and when to go to get it, and where our vaccination sites are. As I said before, Moderna and J&J should be shortly behind. County vaccination sites, so far, we've served 960 people as of this morning with the Pfizer booster. And it's important to note that as the county health department, we did not originally give Pfizer until mid to late March. We've heard there are rumors spreading out there that there's a shortage of Pfizer vaccine due to these boosters. That is not true. We received over 2,300 Pfizer doses from Holy Cross Hospital, and based our projections for the week that there's enough Pfizer and Moderna vaccine to support the current demand at our county and community sites. And I think everybody needs to remember that with the 6 months from the last vaccine, we are not going to experience the mad rush that everybody experienced in the spring when people were desperate to get those first doses. Now we know how many people got vaccinated 6 months ago, and that will help us and the state in their planning for vaccines available in the county. And this nice little map here shows all the places in the county where you can get vaccinated. I will say I don't expect you to remember all the dots because I couldn't tell you what all the dots are, but it gives you an idea of the density of the vaccination opportunities that exist in the county. We're onboarding staff to develop surge capacity, and we'll continue with our pop-up sites. Let's see, I guess the map's up there now. And we plan to expand the volume we can do at the larger facilities, particularly the East County Community Center, the Silver Spring Civic Building, and Montgomery College in Germantown. So we should have 3 large sites available as well as all these other sites. MCPS is being successful at keeping more kids in school now. The quarantine numbers have dropped dramatically. The availability of testing, point of contact testing is an important addition to what they've been able to do, and it's having real progress. In the week of 20th to 24th, they had close contacts of 374, and that's remarkable change from where we were in the beginning. And I just want to give MCPS credit for being able to pivot and turn around the program from that first week. And you can see the results in the kids who are being able to stay in school. They're doing screening in 109 schools. They've administered they've seen a positivity rate of just 1.3%, which is very low. And I think that's generally a lower community, that's lower than our community rate. And yesterday, the Baltimore Sun noted that more than 4,000 public school students have tested positive for COVID, and 16,500 have had to quarantine since the start of the school year. So this is real. I know, in the beginning, we always were talking about how the children seemed to be safe and the children didn't seem to be getting COVID and the children didn't seem to be going to hospitals. That's changed with the Delta variant. And like a lot of other things about COVID, what we knew a year and a half ago is different than what we know now. So please take this seriously. Montgomery County is taken this different approach, and there's some other counties in the state that have yet to mandate masking. It's obviously making a difference here, and it would make a difference wherever this is mandated. And there's no reason for our kids to be getting sick. It's also important to manage the situation in the classroom because we need to keep in-person learning in place. We don't want cases to jeopardize the ability to keep these kids back in school. The data, which isn't just specific to Montgomery County, but is national, shows that being out of school and being in the virtual world had negative impacts on student learning. We started the year in person. We fully intend to keep the year in person, but like a lot of other things that have happened in this county, our ability to do that really depends on the residents of this county continuing to follow through on the advice we're providing. And I'm glad about the partnership we have with Dr. McKnight and her administration, as well as with the Board of Education. And I also want to acknowledge the hard work that Dr. Crowell and our HHS department has been doing in their work with MCPS to support them. There are going to be tough times ahead as colder weather means that there's going to be more indoors. We know that the more indoors people are, the closer and more crowded people get, the easier it is for this virus to spread. We know that because you're vaccinated doesn't mean you won't get the virus. It does tend to mean that you're not going to get really sick, but it's still not an experience anybody wants to have. And there are some small number of cases that get worse than that. So please be cognizant of where you are and what you're doing. And even if we tell you you can take your mask off, you don't have to do that. You're in the flu season. I'll point out that, in the midst of flu season last year, when everybody was wearing masks, nobody got flu. Rather remarkable. So if you're just not in the mood for flu and not taking any chances on COVID, maybe wearing a mask a little bit longer wouldn't be a bad idea. Yesterday, the county council introduced some legislation to mandate vaccinations for all county employees if they don't comply with this mandate. And if they don't, they will be terminated. This is not the way. It was only a few weeks ago we agreed that we would do a combination vaccinator test to stay. We are working with the labor groups and with their membership to directly contact people who have not reported and to work with people who have decided not to get vaccinated. There are a number of reasons for that people have told us about. Some is that employees thought that if they got vaccinated, they wouldn't be able to test, and they wanted to be able to test. Other people want to get the Pfizer vaccine, and we're told that Pfizer was unavailable. That's part of the rumor I mentioned earlier in this. So we're working with our folks to make sure they do the reporting. We have members who thought since they got vaccinated through the county that we had their records, so they didn't go out and supply us their information. So we're trying to deal with that to get to what's the true number of people who genuinely aren't reporting because they refuse to report, and what's the real number of people who aren't vaccinated in our workforce. But currently, 78% of our workforce is vaccinated, and we have about 16% who've yet to report their vaccination status. So we're going to do everything we can do to move people toward getting vaccinated. I've said this myself before. There's no excuse. Unless you've got a religious or health exemption, there's no excuse not to get vaccinated. There is not a shred of evidence that vaccines will hurt you or that vaccines are ineffective. And for people who point to the breakthrough cases and see it didn't work, actually it worked. It kept those people alive. They are not getting seriously ill. They are not being hospitalized. They're like my son and going through 5 days of a cold, which is far less bad than what people experience when they experience COVID without being vaccinated. So I continue to say there's no excuse for not doing this, or the excuses are very narrow and don't apply to most of us. So please get vaccinated, do it for yourselves, do it for the people around you. I know people feel this is their right not to get vaccinated, but your right not to get vaccinated and then your insistence that you should be allowed to go to restaurants and every place else means that your right not to get vaccinated gets translated into your right to make other people sick who actually don't want to be sick. and have done a lot of things to avoid being sick. So I don't have much sympathy for that argument. In fact, I have no sympathy for that argument. If you don't want to get vaccinated, stay in your house. If you're vaccinated, those people who've gotten vaccinated have a right to go out and enjoy the things that are available to them because it's safe. And I just want to be very clear about that. Finally, I also want to acknowledge the appointment of Sonia Moore, who oversees Early Child Care and Education Initiative, Children and Family Matters, and issues related to Montgomery County Public Schools as a special, as an assistant, and CAO, and Jake Weissman, who will have responsibility for economic development and business advancement activities. Both of them have distinguished records, and they're going to be great additions to the county government. And I believe both of them were approved, and Earl was approved. I think the others are waiting approval, but Earl, you got approved. So I'm excited to have Earl on board. Sonia has 3 decades experience working in Montgomery County government, and she was the one who took over and led the our directive for Por Nuestra Salud y Bienestar, that initiative, which was astoundingly effective in getting the Hispanic community in this county vaccinated. And so her leadership there is very, very important. And Jake Weinstein most recently served as Chief of Staff for Maryland State President Mike Miller, and his experience and knowledge of the state is going to be really helpful as we pursue an economic development agenda, which is going to require cooperation with the state. And so I will stop talking, and I'll turn this over to Dr. Stoddard and Dr. Ridders.
Ridders, you can go ahead.
Sure. Thank you, Dr. Stoddard, and congratulations on your confirmation again. This is a partnership. It's a marathon and not a sprint, as we've repeatedly said over the past 20 months. Mr. Elrich gave us great numbers regarding our hospitalization data, our case rate. They're trending in the right direction, and we will continue to monitor that as we've done before and update information regarding the Pulse report. I was responding to a call and am not able to share my Pulse report this afternoon for the update. But as we look at vaccinating in those spaces where we haven't seen high vaccine rates, or we've seen, based on zip code analysis, cases of hospitalizations and post-vaccinations or breakthroughs, we've lessened the gap between Black African American residents as compared to white non-Hispanic residents. It is closed within 2 percentage points. Early on in the year, there was a big gap of 14 or more points. Hospitalization rates continue to decrease. Looking at the CDC data for this morning, there is a 8% change over the last 7 days. So we've been monitoring data on a weekly basis and a 2-week basis and a monthly data basis to peel back the onion to get a more robust presentation on where we actually are looking at cases per 100,000. And so we continue to monitor the data and hospitalization. Lastly, looking at those post-vaccination or breakthrough data, as Mr. Elrich indicated, over the last few weeks, we've seen a decline there as well. Now, keep in mind that the cases that we report as being unvaccinated, that percentage includes those individuals who received a first dose in a 2-dose series or with the J&J vaccine, and even those individuals who have been fully vaccinated. Over the past 4 weeks, of those breakthrough cases, we've had 1,298 cases. 2% of those breakthrough cases, post-vaccination cases, were vaccinated. Even looking at those hospitalization and looking at the hospitalization data for those individuals who may have been admitted to the acute care or ICU units, we've had 37 of those breakthrough cases hospitalized, which is even fewer percentage at 0.01%. And so we continue to look at data. We continue to surveil the pediatric cases at the hospital level to see if there are any trends or any respiratory illnesses. And lastly, as Mr. Elrich indicated, we will publish, if it hasn't been published yet, we're in the flu season. And so we want to make sure that our county employees and our countyans have access to flu vaccines. It is safe to get a flu vaccine, vaccination, as well as a COVID vaccination for those individuals who are eligible and who have not been vaccinated, and even those who are eligible for a third shot, for those who are immunocompromised, and those individuals who are eligible for a booster shot using the Pfizer vaccine. We do encourage folks to consult their primary care providers if they have any underlying health conditions, as we continuously advise folks. I'll stop there. Back to you, Lorna, or over to Dr. Stoddard.
I have just a couple of points I want to add to Dr. Bridger's comments and the county executives as well. So the Pfizer 5 to 11-year-olds, there was news yesterday, as many of you will have seen, that Pfizer did submit data, but they did not submit their EUA application. They're expecting to do that over the next couple of weeks. I do anticipate that will at least slightly, if not fully, delay the release of Pfizer for 5 to 11-year-olds for about 2 more weeks, pending their submission of the emergency use authorization application. Obviously, this is why the FDA has been reticent to give a timeline, because it really is beholden on the company to provide the information required for their review. From when they submit the application, we're expecting it's a 3 to 4 week process for that review and approval to occur. So we're really looking at the 1st or 2nd week of November at this point. And that's where I think we're at with that. Moderna boosters themselves, I believe Moderna has already submitted all the data that needs to be submitted for the boosters for theirs. The FDA is currently reviewing that. My guess is that over the next 3 or so weeks, we'll hear something on the Moderna boosters. J&J, I'm not exactly sure where they're at, but I believe that they had the completed data that showed the booster was an important part of their program as well. I just don't know whether they fully submitted that data with the request to FDA yet. And so with the data completion of their trial, they should be no more than a month behind the Pfizer approval as well. The only other thing we talked about this morning actually is Halloween guidance. What I would expect you're going to see from us is that we're gonna pare back the guidance that was offered last year. Obviously, it'll focus largely on those indoor activities where we pretty universally agree that outdoor activities can proceed, trick-or-treating can proceed this year without many impediments. But obviously, indoor gatherings of large nature should still be cautious. Obviously, still required to wear face coverings, and we'll offer some guidance around that, particularly in environments where you have unvaccinated children gathering in large numbers. Obviously, as we've seen the experience of schools, obviously, you can end up with some quarantines as a result of indoor gatherings that are large, and we're trying to keep kids in school so we don't have to generate quarantines for things like Halloween. So that'll be forthcoming. Hopefully, my guess is early next week. But just to give you a sense, I think trick-or-treating will be a full go this year. We're not going to offer any guidance to the contrary on that, but we may offer some additional guidance on some of those other ancillary gatherings that happen around the Halloween timeframe. So that's all I wanted to add for today, and happy to entertain your questions.
Thank you, gentlemen. And let's get started. First, Kate Ryan, WTOP, questions for the 3 officials. Good afternoon, Kate.
Good afternoon, and thank you so much. I'll start with Mr. Elrich, a quick question for you again on the vaccine mandates, just so we're clear. I know you wanted to see by the end of the week where the self-reporting of whether or not employees have been vaccinated, and that at this point, I think Mr. Wren with McGeo said about maybe 1,500 have not reported whether they are or are not vaccinated. What do you want to see by the end of the week? And would anything prod you to go, no, we do need a mandate? Again, I know you're very clear on vaccines are necessary. People should be vaccinated. But again, if we have a small percentage of county workers who say, nope, not going to do it, what would you do then?
If it's a small percentage, I would live with the consequences. I would, mandate it. As long as unless they had a real reason, not a make-believe reason. But I will say that we're hoping that more people either report or come online and get this done. We're trying to address the things that we know people have said or raised as issue as best we can. I can't deal with, the lunacy of somebody's trying to put a chip in my arm or something like that. But we can, we should be able to deal with the underlying health concerns or concerns that people have. And I've also asked our departments to do an evaluation of at what point could staffing levels get so low that it would impede the operation of the department. My concern, particularly when I was looking at larger numbers, was, and these numbers are still large enough to be concerning, but that we would not be able to put ambulances out, we would not be able to provide adequate fire coverage, and most critically, the folks in the jail would be without adequate staffing. And the last thing I want is a jail where I can't staff it at a level that can maintain the security and safety inside the jail. So all that said, we will have our departments do an analysis of where they think our breakpoints are. And if the number that doesn't get vaccinated doesn't break the system, we can go in one direction. And if the number that doesn't get vaccinated breaks the system, I think we all have to have a serious discussion about it. We have to, weigh the risk. Well, what are the likely exposures? And I think what I mentioned yesterday in my my press release, their statement on this, is that we've continue to allow activities that we know are more at risk and likely could expose more people. And I'm talking about indoor dining directly, where people sit unmasked and we don't even have distance requirements. So we haven't put any restrictions on there in the name of, protecting public safety. I don't think most of our public safety officers produce the same kind of risk in terms of the general population that those activities do. So I'm trying to weigh how to make sure I don't cripple the county for something that may have a minimal impact on whether or not COVID gets spread.
Okay.
This is one of those not fun decisions.
Right. And if I could follow up on, and these are two different arenas, I realize that. Someone once asked me earlier today, what about requirements for group homes for people with developmental disabilities, for example? Should those staffers be mandated? And does the county have the authority to do that? And would you also like to see municipalities, Rockville, Tacoma Park, other municipalities, Gaithersburg, enact vaccine mandates?
What I'd like to see is the federal government enact vaccine mandates, or every jurisdiction isn't pitting itself against every other jurisdiction and doing this piecemeal. If the guidance came from the federal government, much as we don't debate whether our kids should get measles, mumps, and rubella vaccines in the school, they're required to get them or they don't go back to school. If there was leadership sufficient to say this is important enough to do that, it would be nice. And it would be nice if everybody could do this. But, to the extent we deal with, particularly in the government, with continuity of services to people, that's something I think everybody in every jurisdiction is going to be looking at. But I wish it didn't come to that. I really do.
Right. And Dr. Stoddard, you were nodding when I mentioned group home settings.
Yeah, so obviously many of those are regulated at the state level. So I don't know, I'm not a lawyer, don't pretend to be one. So I don't know what legal authority we would have to mandate it in those settings in lieu of the state doing it. But I was really thinking when you said so we did have a meeting with the Montgomery County chapter of the Maryland Municipal League, so the municipal representatives last week. I know some of them are actively contemplating employee vaccine mandates. They're contemplating the vaccine or test model. They're actively looking at those. They are very much looking at what's going to happen at the county level, and that may very well dictate how they proceed. And so I think they're looking for sort of, they want to be consistent with the county, because obviously many of them don't want to do something that's wildly different. And so it's the same conversation the county executive alluded to. It's sort of like there is a very piecemeal decision that's being made, not just at the county levels, but at the state levels and at the municipal levels as well. But generally speaking, yes, we favor, particularly when you're working with vulnerable people in a setting like a group home. A group home is a congregate living environment. And obviously particularly some individuals who have developmental disabilities can't effectively wear face coverings. That's something that we've, seen firsthand. And so obviously that's even a bit different of a risk profile from what we talk about with our fire rescue personnel who are required to wear N95s as part of every patient engagement. And so obviously, that's even a different level of risk than we're talking about with the county employee groups. So certainly there are elements of that conversation that we would certainly support, being mandated.
And just to add, Kate, we've been working, Public Health Services under the HHS umbrella has been working with our agency and developmental services and our congregate living spaces and the local pharmacies in collaboration with MDH to make sure that those congregate spaces, those developmental disability spaces have vaccines and that their healthcare professional and staff are vaccinated. And so we've been working within absent of having a mandate, but I would have to go back to the governor's order. I think that they are required to be vaccinated in order to support that community, as Dr. Stoddard indicated.
Right. So that would affect if I'm a county health employee and I work within those settings, right? I would have to be vaccinated.
Right. I would have to go back to the governor's order, but I know that that early this month or the end of August, he indicated that staff would have to be vaccinated, healthcare professionals and the congregate space staff. But I would have to really go back to his order to see the details of that.
Appreciate that. And then last question, totally unrelated. I'm sorry for county executive, but Annapolis High School had an incident this morning in which 2 students were injured. The wounds were described as puncture, initially reported as stabbing, but a violent incident involving groups of students. They have SROs still in Annapolis. Do you have concerns about, this is the first school year I think we've had in some years that we don't have SROs in school buildings. When you hear of an incident like that, do you have concerns about not having SROs in schools?
Well, I'll just point out if they have SROs, it obviously didn't prevent the problem and 2 people got stabbed. So obviously that's not a panacea. Look, we are continuing to work with the school system. The police department works with the school system. If they get an inkling that there's going to be a problem, which often they do have the ability to use police to deal with discrete events that they're notified about. When I was on the council, I just kept remembering I didn't have SROs when I was in school. I never saw a police officer in my school. And they were perfectly able to discipline people. And we just have to figure out how we're going to do that. And if you've got people bringing knives and weapons to school, they are absolutely free to call the police and get them involved. In no way, shape, or form did we put in place something that prohibits the police from getting involved. And we've got officers who are assigned to these schools and in the community and not far away, so if they're needed, they can get there. It was one of the things in the program was to make sure that officers weren't fully pulled off to other duties, and then you would have to try to bring in an SRO, like bringing in a police officer who might be engaged in the traffic stop or something else. So we tried to find a place in the middle that made officers available, but took them out of the schools as a starting point of their engagement anyway.
Got it. Thank you very much.
So I'll add a couple of things because the Reimagining School Safety and Student Wellness Work Group does fall within my portfolio as an ACAO, and so I'm privy to some of these conversations. Obviously, law enforcement in the schools is the thing that gets talked about the most, but really there's also additional work to, number one, MCBS has their own security in-house, but they also have additional mental health staff that they brought in for this school year and are expanding that out even further as well, because, a lot of these issues show up most acutely as acts of violence, but they often have an underlying mental health issue that leads to them. And so obviously prevention of it getting to the point of the staffing, because as the county executive said, SROs don't necessarily prevent violence from occurring. Really what prevents violence is the work before the violence occurs that can help deal with some of the underlying issues. And so this is definitely an issue that we're paying a lot of attention to. I'm sure that there will be a lot of conversation the first time there's a larger national incident of school violence. We know that will happen. It's inevitable that, in our country with so many guns and other things that you'll have an incident in a school sooner or later. But obviously, there were decades, as County Executive alluded to, where we did not have police officers in schools. The non-public schools all don't have law enforcement officers in their schools and haven't in most cases in any recent year. And so it is a workable system. Police are still responding to the schools when necessary, and we can make this work through another mechanism.
Thank you. Thank you very much.
Thank you, Kate. Next set of questions, Stephanie Ramirez, Fox 5 DC. And I believe you have questions for everybody, Stephanie.
Hi, thank you, everybody. Good afternoon. So I do have a couple of questions for the county executive, but first, I believe Dr. Stoddard and Dr. Bridgers, if you both could address this. I'd like to ask your response to a lawsuit against Montgomery County Public Schools calling for an end to the vaccine mandate, or at least a pause. And the lawsuit quotes a faithful Christian as the person behind this and someone with a religious objection to the quote, usage of aborted fetal cells in the testing, creation, and manufacturing of the COVID-19 vaccine.
Well, Stephanie, I'll start and turn it over to Dr. Stoddard. I have not received any information regarding this lawsuit from our council. So maybe Dr. Stoddard, from his preview as the ACAO, has received information, but I haven't received any information as I've been sitting in this spot over this past couple of weeks.
I've seen the reporting on this morning. Obviously, this isn't a lawsuit directed at the county; it's directed at the Montgomery County Public Schools and their mandate. Few things. Number one, not all the vaccines utilize fetal tissue in their development, so I'm not sure that objection will hold water with regard to the particular elements of it. Now, obviously, I do think that there is some legal precedent for considering both medical exemptions and religious exemptions for deeply held religious beliefs against vaccination. And, we've talked to our county attorney with regard to other mandates that could be considered for county employees. And we do believe that those would both be a necessary element of any real, any well-designed vaccine mandate. So obviously, we're not going to opine on what MCPS, because I don't know that MCPS is fully fleshed out exactly what's going to be the disciplinary process and what the exemptions are. I don't think those things have been fully spelled out, at least in our last conversations with MCPS. And so I would imagine that, I'm not sure whether the lawsuit would be qualified as premature, but certainly, the details of the way that they intend to implement the program will determine what the legality ultimately is defined as. So, obviously we're paying a lot of attention to this. I know that in New York, they had a similar suit and a temporary injunction that was initially issued for the mandate of vaccinations in their school systems. I know that a 3-judge panel did review the case during that injunction and has since allowed the mandate to proceed. And so there are a number of cases like this popping up across the country. And we are, in the cases that have been seen so far, I think unanimously, that they have ruled in favor of the ability to implement a vaccine mandate so long as it is well designed and allows for those reasonable accommodations for people who have the medical and religious exemptions. And so I guess we'll see where the rest of the environment takes us in. But, as we talked about before, there are other vaccines that are required, measles, mumps, rubella. Now that it's a fully approved, FDA approved vaccine, at least in the case of the Pfizer vaccine, some of the underpinning for the arguments against having these mandates from a legal perspective have been solved.
And then a follow-up to MCPS, and I don't know if you guys would be able to provide this information, but on the MCPS side, there's a deadline tomorrow to receive at least one shot for the vaccine requirement for school employees. MCPS has only been able to tell us that they have more than 76% fully vaccinated, but do any of you have figures to show that there was an impact once this requirement was announced, the percentage from when it was announced to now?
I don't think we're aware of. We certainly have that conversation about any reduction in personnel from the school system with regard to.
Or even the number of those getting their vaccine since the requirement was put into place.
They certainly haven't discussed that with us, at least not in any detail. So.
And then this question is for all of you. Obviously, we have some popular athletes who a lot of children especially look up to. DC's Bradley Beal, Jonathan Isaac, who Jonathan gave a more eloquent response as to why he feels he doesn't need to get vaccinated, which is getting a lot of shares. And he talked about how he previously had COVID. He referenced the breakthrough cases that you can have if you get the vaccine. I know that you all have talked about a ton of stats, but if there's just one figure that you would point people to that are seeing these interviews that would make your argument, what would that be?
Sure, I'll start. The vaccines have proven to be effective in preventing severe illness, hospitalizations, and death.
Yeah, I think it'd be very hard to do in one sense. I think Dr. Bridges has done it the best. But I would also point out there was a paper published this week that looks at some of these questions about vaccine efficacy versus natural immunity. And what it shows is that natural immunity provides wide variability in antibody concentrations after infection, meaning that the vaccine-induced immunity is consistently high. There are cases where people who do have natural infections do have similarly high levels of antibody. There are also many cases where they do not. And so being infected by COVID-19 is not necessarily a surefire prediction that you're going to have as strong immunity as you would if you were vaccinated.
And then if I may, the fact that the information came out yesterday that there were around 350, I want to say, positive cases since the start of the school year, since we're now moving to potential vaccine mandates for Montgomery County employees. If we focus on the school year information, how does less than 1% of the entire school body and the staff make the argument for mandates?
Well, I mean, there's a few things to there. I mean, obviously 350 infections has generated something like 6,000 quarantines times 10 days apiece. So that's not an insignificant level of lost schooling, which is why we're discussing this whole test to stay and these other procedures to try and keep kids in school. But obviously the more cases there are, the more you are going to see quarantines. And the more cases that you see are largely connected to the vaccination rates. We're seeing a low level of cases because our community vaccination rate is quite high, but we also have every reason to think that if you follow the patterns that we've seen with this virus, after Thanksgiving, we're very likely to see an increase in cases in our community and therefore in our schools as a result of the cooling weather, holiday-related travel and gathering. Is, even with our high vaccination rate, there are still tens, if not hundreds of thousands of residents who are not vaccinated, in large part because they're not eligible to be vaccinated in many cases. But obviously, at least until we see the 5 to 11-year-olds become eligible, which again, I just talked about that being delayed, the start of that process being delayed, and it's a 6-week plus process once it starts. We're really talking about not having that 105,000 or so individuals being eligible to be fully vaccinated before the end of the year, even if we start in mid-November. So obviously between now and then, there's a lot of people who can get sick. There's a lot of potential lost school days. There's a lot of potential hospitalizations and everything there. So, we really are not inclined to take these severe measures that limit gathering, but our best avenue to avoid all of those things is to get as many people as we possibly can vaccinated as soon as we can.
And just to add to that,
Oh, I'm sorry, go ahead.
after that, Dr. Stoddard said it aptly that, we continue to plan for those, for the demand and those 5 to 11-year-olds once an approved vaccine becomes available. So we've identified larger sites to handle the high throughput. We've had conversations with MCPS and our independent school systems and private school systems. We'll be having a conversation on Friday. So we're planning for that now, but as he indicated, folks are going to be inside more, and we need to mitigate those risks using lessons learned and data from last year when it got cold and we changed seasons, pushing information, more information, education around the efficacy of not only getting vaccinated for those individuals who are eligible to be vaccinated, but to get a flu shot. We know that folks are going to be in close contacts now. And we continue, lastly, to monitor the hospital systems to make sure that We know that we are in a season where more folks have respiratory illnesses, and to look at those respiratory illnesses as the data are reported, as it is compared to hospitalization use. And so those are some of the data points that we track daily, and we have ongoing discussions, and we look at the best practices from around the world and the nation to make our approach more robust.
Is there any kind of date yet to when the test to stay will be enrolled or unrolled in Montgomery County?
What we are doing right now, we can actually say that we've got names that are currently in the MCPS background checking process. And so as that plays out, as we understand how long that takes and how fast the names are coming in from the contract agency, we'll be able to better map out. But I will say the first thing that we are doing with the first staff that come on board is just providing a backstop to the existing testing. As I alluded to, I think in previous conversations with the media, we've had a 5 or so resignations in the last 2 weeks of nurses and techs who have felt just overwhelmed by the existing level of work, and we want to make sure that we make sure that the system is operating as we want to, and then we'll add on additional elements like test to stay once we feel like we've backstopped it well.
How long is that background?
I think we're talking
process?
weeks, not months. We're talking weeks, not months, though. I mean, I think and we'll likely start as a pilot. Just to be clear, we can even give some additional details on this. We had a meeting with CDC level folks yesterday, a Maryland Department of Health level meeting today on test to stay as well. We are in the process of developing a protocol that we will share with MDH as well as MCPS, hopefully by the end of this week. And so we are doing a lot of detail work in the background, but I think the driving thing that will determine is how fast the contract agencies that we've identified can bring in bodies and how fast they can get through the background check process. Once we have the personnel in place, we will have the plan ready to go to do it.
Thank you. Thank you all.
Thank you, Stephanie. Next set of questions, Dominique Maria Bonesi, WAMU, and I believe you have questions for Dr. Sutter, also the county executive. Dominique, good afternoon.
Thank you so much, Lauren. I appreciate it. So Council President Tom Hucker said yesterday that we could lose employees, but we don't know what the effect yet is of a possible vaccine mandate. It seems like from what Dr. Stoddard just said, that there is a concern that the county could lose employees to other counties that aren't requiring a vaccine mandate. Is that your concern, County Executive Elrich, or is that your concern, Dr. Stoddard?
It's certainly one of my concerns, whether I lose them to another county or people just decide enough of this, I'm just going to retire. And we've had people who, have been doing this long enough and are eligible for retirement and weren't going to retire, but at some point they decide this is not worth it. That's why like I said at the beginning, we are asking, our critical departments to do an assessment of how many people they can withstand before the absence of those bodies would lead to a breakdown in our ability to provide critical services. That way we get to the point of, thinking we've wrung out every vaccine we're going to bring out. We can look at what is the implication for our operations. We can have discussions about, what other things can you do that would, people like to think of it as progressive discipline sometime, that might make people more likely to get vaccinated than they are right now. So I guess, my view is there are things we can do, and we'll make that evaluation in conjunction with an assessment of our capacity to operate at different levels of employment.
Yeah, what I would add to that is we particularly recruitment and retention within the public safety space has been an issue of a great discussion, has nothing to do with COVID, has nothing to do with vaccinations at all. So it's already been an underlying problem. We are doing force holds within our fire department, which basically means we're forcibly holding over people into additional shifts to cover for gaps already. And so it really isn't a huge number of employees that would have to decide to early retire or leave for us to be in a real bind. And what we're asking our departments to do, as the county executive alluded to, is to determine what the impact might be of varying levels of staff leaving, just so that we're very clear, particularly with the county council as they consider this vaccine mandate, that there could be, we don't know that there would be, but we don't want to get into a situation where a mandate is put into effect And then we come to the deadline and we see that there's X number of staff from, the corrections department, as an example, who are not vaccinated. We're going to have to begin the progressive discipline. We have to figure out how we're going to staff the jail while we're doing this progressive discipline. So we're really just trying to understand what the impacts will be in terms of retirements, people leaving, people, basically calling our bluff and making us put them through the progressive discipline process would be, and understanding what that would mean in terms of the critical services upon which our residents rely. I think everyone supports, I think most of our residents support vaccination. That's clear from them getting vaccinated. I think many of them would support a vaccine mandate, but I think many of them would say, I also don't want to see a 10, 20, 30-second reduction in the time it takes, or an increase in the time it takes for an ambulance to arrive to my house either. And so I think we just need to understand, we don't know that those things would happen, but we need to understand what the risks are before we really engage in a conversation around, going all the way with the vaccine mandate.
Thank you. Yeah. And so in general, I mean, how many bodies across the county, employees, would the county be able to bleed or lose and still maintain some level of operation? Do we know? Or is that why you're doing the assessment?
That's why we're doing the assessment. If I knew that answer, I would just say, if I get below X percent, then this doesn't work. So we're going to do the assessment while we go through the process of trying to drive all the numbers where they need to be.
Which offices? I'm sorry. Which offices?
Sorry, I was going to say, not all departments are created equal too, right? Some departments, like, police, fire, corrections, it's months, almost a year of training to get you to the point where you can operate on the street. It's not like we can move, okay, we have extra, librarians or rec center employees, and we can move them over as we've done from previous parts of that doesn't work within certain spaces. The same is true of nurses and other social workers, things like that, where there's specialized training and education necessary. You can't backfill in the same way that if you have other kinds of work where we could bring in a contractor to do, repairs on buses or clean our facilities, for example. We can't do that on the public safety side. We can't do that in a correctional facility. We can't do that for nurses, as we're finding out right now, as we talked about this day, we're having a hard time finding medical expertise bodies. So obviously, I don't think that's where our unvaccinated employees are at based on our data. But just to give you an example, that it's not everything's created equal in terms of programs, in terms of the impact of retirements or leaving or discipline.
And just what agency is doing the assessment, and when might that assessment be available?
Yeah, we're going to ask the departments, particularly with the specialized trained personnel, where we know that there's a large gap of either people who have said they're not vaccinated. I think the highest percentage of any departments, like 13%, say they're not vaccinated. The most common thing is we have, on average across the county, 17% have said who haven't given us a status, but a larger chunk of them are in fire rescue, corrections specifically. So it'll be the departments where you have the largest number of A, unvaccinated persons according to our chart, and B, people who have not described their status, because they could have a lot of unvaccinated, we just don't know. And so it's really those departments that you see that have the highest percentage of unknown or known to be unvaccinated employees.
All right, thank you, Dr. Stoddard. Thank you.
What's the deadline for that?
Dominique, hold on just a second. Let's get to Rebecca Tan. She's been waiting quite a bit, and then we can do your follow-up. Rebecca, good afternoon. You still there? Thanks for your patience.
Yep. I actually have another follow-up, again on the vaccine mandates, just to clarify the county executive's position. Right now, we have about 17% of county workers who haven't reported their vaccination status. If they do report, and it turns out most of them are vaccinated, would you then, be in favor of a mandate? And is your opposition, more toward the timing of this mandate above all, or what?
Well, I mean, there was no discussion about going from point A to point B. So we had a plan. We said we were working with the council approved. And then suddenly we're at this. I will point out the council talked to nobody. They didn't talk to employees. They didn't talk to unions. They didn't make any effort to find out, what were the problems. In our talking to them, we've found out reasons why people may not have reported. And we're trying to work through those things. So, it wasn't a very let's sit down and work at this and get to, a place where we can deal with this problem. It's just, frankly, in my mind, just political nonsense. So it is what it is. We're gonna try to get this done as quickly as possible. Early on, I was very clear. I don't have a problem with mandates. My problem is, I'm not just dealing with COVID. I'm dealing with running a county that relies on certain services. So
Right.
I've got to balance those two things against each other, and have a serious discussion with our health professionals, which I would hope other people were interested in, to evaluate the risk of doing certain things or not doing certain things versus not being able to deliver a service. Earl talks about a delayed call of 30 seconds. 30 seconds would be my dream scenario. I'm worried more like not being able to run an ambulance out of a firehouse and wind up having to wait 5 minutes. We fuss over things like response times when we talk about how we do staffing in the county, particularly in fire and rescue, and particularly around the ambulance functions. And we're told, and I've been told all the years that I was on the council and every time we meet with these folks, that minutes matter in saving someone's life.
So
I
just to
am not going
clarify,
to get people killed by doing this.
God, and just to clarify, you're not principally opposed to a mandate, right?
No, I'm in favor of mandates. It's just like sometimes life's not neat. It's like everything isn't, you can do A and B and they're both the same. If A has really bad consequences, I have a responsibility to evaluate those consequences. No one is going to be happy with us if I tell them, well, that ambulance was late and, your husband died of a heart attack, but damn it, those people didn't want to get vaccinated. So what was I supposed to do? That's not going to sit really well.
Sure. And one last follow-up for Dr. Stoddard, maybe. How long is this assessment going to take? A public hearing is scheduled for this bill in 2 weeks, which is quite a long time.
Yeah, we will have the assessment done before the public hearing for sure, because we want that to be part of the public discourse for this.
Dr. Stoddard, your audio is a little bit going off, and so it's your video. We're having some flashes in your video. Do you want to repeat that, please?
Yeah, it'll be done before the public hearing. No question about that. We want this to be part of the public discourse because there's a weighing of concerns here, and obviously the concern of vaccination versus the concern of what could happen in a reduction of service, and how you balance those two things out legislatively, I think is important for the council to understand.
Sure. Thank you both so much for your help.
Thank you, Rebecca. Dominique, I'm sorry, do you have another follow-up?
Thank you to Rebecca for asking it.
Okay. All right. Well, thank you, everybody. I do not see any more requests for questions from members of the media on the chat. Going once, reporters, going twice. Thank you for your time. I guess we're done for today. Thank you, everybody. Stay safe. Have a great afternoon, and we'll see you soon.
Thank you.
Bye-bye.
Bye.